Welcome to Learn with Livanta, Medicare, the BFCC-QIO, and you. Livanta's podcast where we bring you up-to-date information about QIO services and the overall Medicare landscape. Livanta holds a contract with the Centers for Medicare and Medicaid Services as a BFCC-QIO, or Beneficiary and Family-Centered Care Quality Improvement Organization. BFCC-QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high-quality health care, and BFCC-QIOs like Livanta protect that right. In this month's episode, we have the opportunity to learn about Livanta's Landscape Assessment, a large-scale project being conducted by the communications team through a discussion with Catherine Wiley. Catherine Wiley currently serves as Livanta's QIO Communications Director. She holds a master's degree in business administration and an undergraduate degree in journalism. She's also held roles in long-term care and public health and specialized in crisis communications. She is passionate about communication in the healthcare space. Before we move into our conversation with Catherine, we're going to hear a case study where immediate advocacy was able to help out a Medicare beneficiary. The true-to-life story you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta, including immediate advocacy, help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
My dad fell a few months ago and broke his hip. He had surgery to replace his hip because the break was so severe. After he spent a few days in the hospital, he was transferred to a nursing home for rehabilitation, especially physical therapy. Unfortunately, I live a couple of hours away from him, and I wasn't in a position to take time off from work to be closer to him. I called him at least once a day while he was in the hospital and continued checking on him after he arrived at the nursing home. However, after a couple of days at the nursing home, Dad still hadn't received any physical therapy. He was still confined to his bed and completely dependent on staff for his needs, such as water, medications, and food. He was unhappy with his care, and so was I. Fortunately, the weekend was coming, and I could go visit him in person. I could help him while I was there visiting, but I was worried that he wouldn't get the care he needed after I had to return home. He said he would call the nurse's desk from his room, but that it would take a very long time for anyone to come to help him. It broke my heart to think of him lying in that bed and not being taken care of. So I called and spoke with Dad's nurse on his second day to try and find out what was going on. His nurse didn't sound concerned when I spoke with her, and I didn't feel like anything was going to be done about his therapy or getting help when he needed it. I decided I wanted him transferred to another facility. I had a couple of places in mind that a friend had recommended to me, but I didn't know how to go about getting him transferred. I'd never been through this before, and it was all new to me. My friend also recommended that I call Avanta. She said they had helped her when her mom was in the hospital. She gave me the phone number, and I called right away. The Livanta advocate listened to my concerns and asked a few questions to make sure she understood them. She explained Levanta's immediate advocacy service to me. She said she could call the facility on my behalf to help resolve my problem, and I agreed to allow her to contact the facility. The advocate called me back later that day and told me she had left a voicemail and would call again, but wanted to keep me informed in the meantime. The following day, Dad's case manager called me and explained his therapy plan and goals. She said she would leave a copy of his plan in his room for me for when I came to visit. She also said she had spoken with the staff to ensure Dad received better care. When I visited him later that day, he told me he had a good physical therapy session and the staff had been very attentive. I found the copy of his therapy plan just as the manager had promised. The Livanta advocate called to follow up with me to make sure the case manager had spoken with me. The next several days continued in the same manner and Dad improved. I no longer felt the need to have him transferred to another facility. I finally felt like my dad was being cared for in the way that he needed.
To start and ground our conversation today, could you tell us about the landscape assessment that the QIO is conducting and why it's so important?
Livanta is communications department has always been focused on promoting the accessibility of services and connecting with key stakeholders and Medicare beneficiaries and their families and caregivers to better understand what the BFCC-QIOs do. We are conducting this landscape assessment, which is an environmental scan that engages new and existing stakeholders, our partners, to better understand what the knowledge gaps are with Medicare's beneficiaries' understanding of their rights under the BFCC-QIO program in the CMS regions that we cover, which are regions 2, 3, 5, 7, and 9. The landscape assessment are robust conversations and discussions with these stakeholders where we dig deep and ask questions that are very focused to glean a better understanding of what beneficiaries do and do not understand about the services available to them and why we exist. And this work is important because it will help us to inform CMS what next steps need to be taken to ensure that beneficiaries understand their rights under Medicare.
One of the things that we're working on as part of this landscape assessment is exactly what you just said, finding out those knowledge gaps about Livanta services. For the listeners, could you just start by doing an overview of the services that we provide here at Livanta as the BFCC QIO at no cost to Medicare beneficiaries?
There are several services that we provide at no cost. Livanta is focused on helping Medicare beneficiaries with their quality of care concerns. And so we do quality of care reviews. And these include concerns that a beneficiary may have about the quality of medical services that they receive from a healthcare provider. These complaints can be filed in regard to any setting that a Medicare is accepted as a form of payment. Immediate advocacy is another service that Livanta provides, and this is an informal process. BFCC QIOs coordinate immediate advocacy that aren't necessarily related to a clinical setting. It's a faster way to get an issue resolved often, and it does not remove the patient's right or the beneficiary's right to still file an appeal if they feel it's still necessary. And the immediate advocacy process is often a quick way to get anything that's been misconstrued or just maybe misunderstood taken care of so that they don't have to continue further with next steps. And it's usually faster. We also do discharge appeals, and a Medicare beneficiary can contest a discharge decision. And if they feel like maybe they're being discharged too soon from, say, a hospital or a skilled nursing facility, the QIO will go ahead and do an overall review of the case to ensure that everything's been done properly. And it's a way to appeal the hospital's decision or the SNF's decision, the skilled nursing facility's decision to release them. And our physician reviewers are still practicing in medicine, so they're not just retired and kind of looking at something. We try to really do apples to apples comparisons, so their patient population looks like the patient that the patient's case they're reviewing. And then also too, it's really important to understand who can file an appeal. A Medicare beneficiary, a family member, or a designated representative can file an appeal regarding the care of a Medicare beneficiary. And Livanta will notify the beneficiary of the decision via phone or mail. And our goal is to ensure that the care was reasonable and necessary. Because another responsibility that Livanta has is also protecting the Medicare Trust Fund to ensure that it's available for everyone that needs it. And I did want to just kind of talk a little bit about how to initiate an appeal and then the review process, if that's okay with you. You can initiate an appeal in two ways. You can either contact Livanta via phone, or you can file an e-appeal, which is an online appeal through the portal on the website. The website is available 24 hours a day, 7 days a week, to start to file the appeal process. That process is for new appeals, not a reassessment. And it's often the appeals can be fast tracked. So it's important to understand and read the important messages from Medicare regarding non-coverage. So generally, the appeal process will be followed up within 24 to 72 hours. Livanta is really good about sticking to make sure that the patients get exactly what they need. And we want to make sure that all of our partners, facilities, and decisions are aligned within professionally accepted standards for Medicare.
Thank you, Catherine, for giving us some more insight into the services that we provide here at Livanta. Another key element of our work through the landscape assessment is related to identifying gaps in knowledge. And the term that we commonly use in reference to some of these gaps is health literacy. So could you tell us a little bit about what health literacy is and what it means here in the context of the landscape assessment?
Sure, Noah. So it's really important to have a clear understanding that health literacy encompasses a lot of issues. It's the ability to understand and use health information and services to make informed health decisions. It's important because health literacy helps people maintain good health and overall well-being. It also helps to reduce healthcare inequities. So the combination of knowledge and skills that it really helps people to develop better activities for better daily activities, social interactions, and life life quality that's improved. One of the challenges with health literacy is it isn't just about understanding maybe key words. It's also involves things like calculating numbers, how to communicate with a healthcare professional, someone's basic literacy level in terms of reading and writing. Because the challenge is a lot of people have the tendency to smile and nod if they're talking to a healthcare professional and they're saying, "Do you understand what I'm saying?" And they'll just kind of smile and nod. And they may not have any idea exactly what they're really being told. But it's really important because if people don't really understand the instructions they're given, they can take medications incorrectly. They can be in situations where maybe two pills look the same and they take the wrong dosage and creates a health problem. And also it's the ability to know when to ask questions. And a lot of times that's something that's embarrassing for patients. They feel like maybe it's something they should understand and they don't. So overall, it is really about ensuring that patients can advocate for themselves. So healthcare literacy is really important, and it's important that providers and practitioners check in to make sure that their patients understand what they're being told, because health literacy can also cross borders when you're talking about language barriers and other things too that can basically impact what they do, because often someone may be able to speak one language but they may not be able to write it or understand or read it. So those are real challenges that can create healthcare inequities and impair outcomes overall. Because the reality is, as we're looking at health literacy, we're talking about often technology. And that can be a big gap when you're talking about older adults. What's interesting is you find that some older adults completely embrace technology and some will not use it at all and don't have internet access and have zero desire to learn how to do that. So oftentimes people find it challenging to navigate healthcare systems because they may not be able to complete paperwork online, which is one of the things that a lot of healthcare systems offer and often require patients to do. They have difficulty and may need someone to help with that digital literacy piece. Because patient portals are where you're going to find results and information and those kind of things too. And that's really a newer thing for most patients where they're used to getting information via snail mail or via phone and waiting to connect back with the doctor's office and coming in to find out what an issue is, where they can find out on a portal in a lot less time to maybe find out what their next action step should be in order to create a better care plan. So that's another big piece. And understanding that those technical terms that are being used and jargon, I think those are all big factors. And then numeracy is another skill. I think that maybe we don't have that conversation enough. Oftentimes, if someone has trouble calculating anything that's related to their medications, be it, say, its dosages, or monitoring blood sugar, or understanding health statistics that they're comparing where they are versus where other people in their same age group demographically are, they may not understand why those things are important. So really, the way healthcare is being practiced now is different than it was decades ago, and it will probably continue to evolve and improve. And then lastly, I think another challenge is people do have good digital literacy. They'll go online and they'll start looking for, okay, here are my symptoms. And maybe rather than go to a doctor, either start treating themselves or come in and tell the doctor what they have. So that's another challenge too, I think, that the healthcare system faces that it didn't really face in the past.
And through this landscape assessment process, we've already released 4 parts of the full report, which you can find at our website at levantaQIO.cms.gov/en/about/landscape, LANDSCAPE reports, REPORTS. Our most recent release, Part 4, takes a deep dive into what differentiates each of our regions and territories. Can you give us a few insights from this initial level of research into the Medicare beneficiaries that we cover?
Well, there's a few things that are really important about the part 4 of the series because it really includes a lot of data information. It includes census results, insights about the older adult population across the regions that Livanta serves. And then it includes some regional summary information that's very state specific. It talks specifically about some demographic breakdowns about not only who the Medicare that there are the number of Medicare recipients, but what they really look like potentially. And I guess one of the biggest things about this is it gives a different picture. So it puts more of a face to a number. The reality is when you hear the term older adults, you may have a vision of what someone may look like. Maybe someone with gray hair, maybe someone on a walker, whatever the case may be. But oftentimes you have people in a wide variety of healthcare ranges. And it gives a clearer understanding of where patients live in terms of access to care, adults who live in more rural communities versus adults who live in more urban settings. And it also speaks to, what's happening in these state-specific and territory-specific areas that we may not be aware of, or that people may not be aware of, because in addition to the states that we cover, we also cover all the U.S. territories too. So there's going to be some differences there when you're looking at Puerto Rico and the Virgin Islands and some American Samoa and the Northern Mariana Islands, and how those things impact the overall healthcare. So it's healthcare landscape. So it is really an interesting dive and to learn more about different regions and how they're impacting and the landscape assessment itself, and how it's informing us on how we're doing that outreach to those groups.
So, with all this in mind, the information that we've already gathered, why is it so important to take into consideration regional, cultural, and religious differences when taking a look at healthcare for older adults?
Well, when you're looking at older adults, what you're really referring to is called cultural competence. And cultural competence in healthcare is really the ability of healthcare practitioners to provide personalized care to patients that are diverse, that their values are diverse, their beliefs are diverse, and their behaviors are impacted by what they believe. It also involves a great deal of understanding or respecting a patient's cultural beliefs and values and practices and what's needed. One of the things I learned with working in environments that are culturally diverse is it isn't just language barriers that are challenges, but it's really important to understand and be aware of attitudes, awareness, and differences so that practitioners can really best help these patients. Um, and this is important because it simply informs better healthcare decisions. It helps practitioners to recognize a patient's needs better. And it also helps them to better understand if they're culturally competent, the patient is a lot more likely to disclose information that they may not otherwise disclose if they don't feel comfortable. Or it opens up the room and opportunity for them to ask questions where they might not otherwise do so. What we find, one of the things we found as we go across different groups of older adults is that some older adults have a tendency not to question a practitioner. But if they're in a setting where they feel comfortable, they can ask questions to get a better understanding and ensure that they're taking their medication correctly, or to find out if they have access to the medication for any myriad of reasons. If they have challenges, say, for example, keeping their utilities on and their medication needs to be refrigerated, that's something that a provider needs to be aware of, because either they can find a way to help assist them or they can give them something different that doesn't have that requirement. So it's that understanding and that ability to uh, look past differences and embrace those things in a way that improves the overall healthcare system.
After we complete this landscape assessment process, how can we use this information about Medicare beneficiaries and gaps in health knowledge to improve quality healthcare for seniors?
Well, one of the things that Levanta's communication team is doing is that we're going to use that information and knowledge gain from the landscape assessments because it's really a deep dive. We are engaging in very robust conversations and getting not only anecdotal information, but also quantitative information to better understand where the challenges are in terms of beneficiaries' understanding. And once we know where the gaps are, we'll be able to create education plans and programs and opportunities to better educate and create better materials to better educate Medicare stakeholders, beneficiaries, and their families to improve the interaction overall with the BFCC-QIO program. One of the challenges is that people know they have insurance, but they may not understand what all is covered or how Medicare really works or how insurance really works. And until they have a challenge, they have not engaged with the system. So this is an opportunity for us to provide some education about engaging in the healthcare system and how the process works to ensure that they get better outcomes.
Thank you so much for your time today, Catherine. I want to give you one last opportunity if there's anything else that you wanted to share today about Livanta services, health literacy, or the landscape assessment before I let you go.
Great. One thing I guess I would like to share is that the landscape assessment reports series is really something that is designed to be helpful to stakeholders as well as Medicare beneficiaries alike. And right now we are in the process of wrapping up those conversations and questions to complete the final report that we're actually going to submit to Medicare. But the first four reports are available online to review to really give beneficiaries and stakeholders a better understanding of the process and things that they can expect in case of a challenge. It's it's easy to read, it's very digestible, that we use plain language to ensure that there's not a lot of jargon. And it's a great opportunity to engage and use these as reference tools. So I do hope that you'll take a look at it.
As we wrap up this month's episode of Learn with Livanta, we wanted to remind you that more information about the BFCC-QIO, your state or territory's helpline number, and the free services that we provide can be found by visiting our website at www.livantaqio.cms.gov.